Hi guys, welcome to day 2 of week 6. If you remember from the week 1 video, I said this week we were dealing with computers and managing the medical record or the patient's record. That meant that we were dealing with chapters 7, 12, and 13. Now in the day 1 video, we dealt with chapter 12, which talked about computers in the medical office. So that means for this day 2 video, I'm going to talk about chapter 7 and chapter 13. So let's get started. Chapter 7 is dealing with telephone etiquette and telephone technique. So just like the computers we learned about yesterday, the telephone is really one of the most vital pieces and vital tools you will use in the medical office on a daily basis. The key within the medical office is to ensure that every phone call and every encounter is not only courteous, but also efficient, accurate, and professional. Attention to detail is required when answering the telephone, but also when taking the messages or taking refill requests. You're putting patients' lives in your hands when you answer those phone calls. The fundamental rule to remember when answering a phone call and in the medical office is not to answer it like you do at home. And you all know what I'm talking about, okay? Medical offices do provide you with a script for answering the phone calls, so don't be worried. We'll teach you how to be pleasant, professional, and answer them correctly. When you're answering a phone call in a medical office, there are 5 key items to keep in mind. First and foremost, number 1, smile. Okay, pretend like the patient's sitting right in front of you, or you're calling them back from the waiting room. Give them that smile so they can hear it in your voice, so they're already feeling the pleasantness come from this office. Okay? Number 2, have a good greeting. Okay? For the greeting, you want to include the name of the office or the physician you're working for, your name, and then ask how you can assist them. For example, thank you for calling OSF Medical Group, Rock Cut. This is Corey. How can I help you? I can hit all those things and I have a really good greeting. And then patients can tell me what they're calling for and what they need and how I can help them. Also try to answer that phone quickly, generally within 3 rings. After that, patients start to get a little irritated. Number 3, have a good speech. Now what I mean by that is to use clarity. Make sure that you are understood. Your mouth is clear, there's no gum or gargle or goop up in there. Make sure that you are speaking clearly. And enunciate your words. Make sure that you can articulate what you're trying to say and pronounce every word clearly. Also, watch the pitch and tone of your voice. If you're super monotone, patients are not going to be happy and not want to come to this office because they're going to feel like you don't care. But if you're also kind of having a really high-pitched voice, they may not want to come either. Keep that professional tone of voice going throughout the whole phone call. Number 4, identify the caller. I know it sounds kind of crazy because you've got the patient, they're going to probably give you your name and why they're calling. But you also need to use some patient identifiers. So just like if you're rooming the patient, always ask them to verify their name and their date of birth, so that way you make sure you have the correct person on the other end of the phone, because you don't know that you don't have the patient. Okay? And lastly, and I think almost more importantly than any of the others, listen to what the patient is saying to you. Patients don't want to have to repeat information. So if you are not listening and giving them your full attention on the phone, you're going to miss things, and those things could be vital to their care. That is where I'm going to stop for Chapter 7 this week. It is a great chapter for you guys, so please make sure that you are reading that completely, and bring any questions that you have to class about that, because we will be doing a telephone technique and telephone etiquette exercise on day 2. Now, let's talk about Chapter 13. So Chapter 13 is dealing with managing paper medical records. I know, probably are starting to wonder why I'm having you learn about paper medical records when you're probably more often going to deal with electronic records. But truth be told, there really is some doctor's offices out there who are still using paper medical charts. Okay? Maybe they can't afford to use the new EMR system, so they're going to use their paper medical charts still. We need to know how to work those. We need to know how to document those. You need to know how some of the important pieces of medical records. So regardless of whether you're using paper medical records or electronic medical records, the standards still apply for both. Okay? There is no difference between a paper or an electronic. They both get treated the same. And a medical record in any form is really a document that contains, or a chart that contains written documents that relate to the patient's health care. And the medical record is a legal, permanent document. It's a tool that we use in the medical field to not only communicate within our office, but also outside of our office. So if we were to refer a patient out, they're going to need that medical record as well. Okay? Because the medical record is a legal document, everything that is done during a patient's visit, during a phone call, or through an email, because now we have My Health, My Chart, anytime that there is some form of a communication or an interaction, it needs to be documented. And everything that happens needs to be documented. Because the motto is, if it wasn't documented, it didn't happen. Nobody wants that. Because these charts can and these records can go to court, you don't want that to harm you in the future. All entries should be written in black ink, and your handwriting, if you're doing a paper medical record, should be written as clearly as possible so it's easy to read. You also want to make sure you sign, date every single entry, regardless of how small or how little it is or how soon after the first one it happened. Always sign and date and timestamp every single entry. Documenting should be done in a factual manner, and it should be based upon patient statements during the visit and the physician's assessment during the visit and after the visit. Those are all factual things that happened. You can't make it up, and you cannot put in your own opinions in the patient chart. That is unacceptable. Now, we're all human. We all make errors, so it's probably going to happen that you'll make an error in the chart. And there's a way to correct those errors that is appropriate. So you always want to make sure whoever made the error is the one that does the correction. But you cannot simply just erase the error. Because we wrote it in ink, we can't erase it. So what you need to do is simply draw one line through the error so that the original documentation can still be seen. Put your initials and the date above the line where your error line, and write the word error. After you do that, there's a couple of things. After that line is drawn, then you can write the new documentation or the correction that needs to happen. Now remember, if you find an error and it was not you who created the error, you need to go to the person who did the error. Bring it to them in a tactful and professional manner. I generally suggest that the best way to do this is take it to a private area. Don't call them out in the middle of the office. Say, hey, you made an error here, let's fix that. Take it to them privately so you guys can discuss the error and not have everyone see what's happening. It's really important to understand that the medical record itself is owned by the patient. But the facility or the office that created that information owns the paper, physical copy, or the electronic copy. Patients have the right at any point in time that they want to view their records. They have that right. They can also get a copy of that record if they want that. But if a patient wants to view their medical record, it's really important that a staff member or a medical assistant is with them when they view that, in case there's any questions about their medical record, or on the flip side of that is if you don't want them to make their own corrections because you don't necessarily know if that's right. Sometimes patients want things taken out of their chart because they don't want somebody to see it because it could be seen as negative, but everything that we put in there has to stay unless it really can be removed. And if that's the case, remember that's a correction. You have to take it back to the person who actually made that error. Now, because patients own their own medical record, we need their permission in order to release any record. So, at the first new patient visit, when patients come in, they're given a Notice of Privacy Practices form. And they sign off on that form saying that it is okay for us to give out their information to other physicians in the need of their medical help. Okay. This form, again, says that patients give us consent to do so, but we still stay within those HIPAA laws. So it's really only for treatment information, payment information, and for operational purposes. Now, they get that at that first visit, but then they will get it every year annually after that. It just keeps it up to date, and that they still say it's okay for us to give out their records. All right, everyone, this is where I'm going to stop with Chapter 13 as well, so it's going to be the end of the video. But I still want you guys to make sure that you're reading your chapters in full and bring any questions that you have to me on day 2. Have a wonderful week, guys. Bye-bye.